Bismillahirrahmanirrahim. My name is Dr. Awais Naeem. I am Assistant Professor and Chairperson, Department of Medicine, Herbert Teaching Hospital. I remain the focal person for COVID-19, dengue epidemic, as well as infection prevention and control for Herbert Teaching Hospital. The topic of discussion today is patient-friendly hospital initiative by World Health Organization. So, how dangerous is the healthcare system? So, just give an example. There will be one death per more than per 1 lakh encounters if you go down to a nuclear power station, European railroads, or scheduled airlines. There will be one death in less than 1 lakh per greater than 1,000 encounters when you are driving or in a chemical manufacturing industry. But there will be more than one death per 1,000 encounters if you are bungee jumping, if you are mountain climbing, or if you are in a hospital. So hospitals are quite dangerous when it comes down to errors, come down to patient safety. Types of error. So number one is adverse healthcare event, which per definition is an event or omission arising during a clinical care that causes physical or psychological injury. The other term is error, which is failure to complete a planned action as intended, or the use of an incorrect plan for the action to achieve a given plan. Number three is healthcare near miss. It's a situation in which an event or omission has occurred arising during a clinical care, but it fails to develop further, whether or not as a result of compensating action, thus preventing injury. सो नियर मिस के अंदर आपको नुकसान नहीं पहुंचता पर गलती हुई होती है. एडवर्स ड्रग रिएक्शंस. Any response to a drug which is noxious, unintended, or occurs at doses used for prophylaxis, diagnosis, or therapies. It is predictably unpredictable. आपकी overdose नहीं हुई, ये adverse drug reaction unintended है that has occurred at a prophylactic dose or a treatment dose. Fifth one, medication error. ये preventable event है that may occur or is caused by inappropriate medication used in patient or patient harm while the medication is in the control of health professional, patient or consumer. ये एडवर्स ड्रग रिएक्शन से डिफरेंट है. एडवर्स ड्रग रिएक्शन में आपने वो ड्रग देनी थी प्रोफिलैक्टिक या ट्रीटमेंट डोज में, वो उसको मिली, उसका रिएक्शन आपको प्रिडिक्टेबल नहीं था, वो रिएक्शन हो गया. कंपेयर टू मेडिकेशन एरर, इसमें ड्रग मिलनी ही नहीं चाहिए थी, वो इनअप्रोप्रिएट दी गई है. एंड सेंटिनल एरर इज लाइक सर्जरी ऑन अ रॉन्ग पार्ट ऑफ द बॉडी, सर्जरी ऑन अ रॉन्ग पेशेंट, or patient receiving a wrong medication. History. A study was conducted in 2009 in 6 countries of Eastern Mediterranean region and showed that 18% of the hospital admissions were associated with patient harm as a result of medical intervention. WHO started a patient safety friendly hospital initiative. This initiative is to enhance the implementation of patient safety practices in healthcare facilities. What does it involve? It involves the implementation of set of patient safety standards in the hospital. Compliance with these standards ensure that the patient safety is the priority, and then healthcare facilities and staff implement the best practices for patient care. The standards were developed and revised by a group of regional and international experts. The pilot study was done in countries of Egypt, Jordan, Morocco, Pakistan, Sudan, Tunisia, and Yemen. And experts were trained to conduct the initial baseline assessment. Based on the standards and implementation of guidelines in one pilot hospital in each of the countries. So what do we want from this initiative? Well, the main goal is improving the level of patient safety as it has a direct bearing on number of lives saved and disability prevented as a result of medical care provided to hospitalized patients in the developing country. Evidence is progressively emerging from the developed countries, and there is slow but steady increase in the level of awareness of the risk of unsafe practices or among the healthcare professionals, and policymakers and practitioners have taken a notice of it. The risk of healthcare associated infections can be up to 20 times higher in developing countries compared to a developed country. It seems imperative that in developing countries, efforts of gathering evidence related to unsafe cares are undertaken, and tackling of this problem is of utmost importance. The principal approach of patient safety friendly hospital initiative has been developed on an assessment manual that has around 140 patient safety standards across five domains. The domains include leadership and management, patient and public involvement, safe evidence-based clinical practices, safe environment, and lifelong learning. These five are the main domains. And then there are standards which needs to be followed up by each hospital when they enroll in patient safety friendly hospital initiative. Ministries of the 7 countries, Egypt, Jordan, Morocco, Pakistan, Sudan, Tunisia, and Yemen, were asked to nominate one hospital while doing the initial assessment and then follow up with the improvement plan. The Patient Safety Friendly Hospital Initiative is a WHO initiative at assisting institutions in the countries to launch comprehensive patient safety program. Ultimately, the hope was that this initiative will be owned by the national institutions and Ministry of Health. And awards and certificates of achievement is at the discretion of the national authority, such as Ministry of Health and national accrediting bodies. In this initiative, all the hospitals were allowed to participate, whether public or private, and can benefit directly from the initiative from benchmarking and self-improvement. In a way, एक प्रोग्राम डिज़ाइन किया गया जिसमें सबको ऑफ़र दी गई कि आप इन स्टैंडर्ड्स के ऊपर अपने आप को पूरा करें एंड एक पेशेंट सेफ्टी फ्रेंडली हॉस्पिटल इनिशिएटिव का पार्ट बने एंड दैट और उसको एक बेंचमार्क बनाया जाता ऑफ सेल्फ इम्प्रूवमेंट फॉर पेशेंट सेफ्टी। इन स्टैंडर्ड्स को डिवाइड किया गया इनटू क्रिटिकल, कोर एंड डेवलपमेंटल स्टैंडर्ड्स। There are 20 critical standards, and it is compulsory for all the hospitals who intend to enroll in the patient safety friendly hospital initiative is that they achieve all the critical standards. These are 20 in numbers. Rest of the standards can have variable numbers, but it is compulsory for everyone to have the critical standards achieved. And when the surveys were done, in the critical section, the overall score of the participating hospitals in these 7 countries were around in different domains were ranged from 8 to 78%, while the target was around 100%. In the domain of leadership and management, there was highest compliance at around 47%. For patient and public involvement, it was at 25%. The safe evidence-based clinical practices were at around 53%. Safe environment, which included proper waste disposal, was at 64%. And for lifelong learning, that involves development or educational programs for the healthcare workers, it was at 27%. So most of the core components were not achieved by any of the hospitals. What is safety in the hospital and why it is important? As we know that hospital is a people-intensive place. So provides services to sick 24/7, 365 days per year. Patients have free access to enter any part of the hospital most of the time. The hospital environment is filled with emotions, excitement, life, happiness, death, and sorrow. Since the hospital operates under continuous strain, it gives rise to irritation, confrontation, conflicts, and aggression. And that threatens the life in hospital of the hospital staff and hospital properties. So safety is always concerned, whether in terms of patient safety or hospital or healthcare worker safety. Patient safety is the absence of the preventable harm. हम क्या कोशिश करते हैं कि जो चीज़ को हम रोक सकें उसको तो कम से कम रोक पाएँ. तो preventable harm to a patient during the process of healthcare exposure. The discipline of patient safety is coordinated efforts to prevent the harm to the patient caused by the process of healthcare itself. It is generally agreed upon that the meaning of patient safety is please do no harm. तो अगर हम किसी को फ़ायदा ना पहुंचा सके तो उनके हेल्थ केयर इनकाउंटर पे कम से कम उनको नुकसान ना पहुंचाएं. Purpose of this patient safety friendly hospital initiative was to provide standards, a framework to the hospital to enable them to deliver safer patient care by assessing hospitals for patient safety perspective, building capacity of the staff regarding patient safety, and involving consumers in improving the healthcare and safety. Objective is to enhance the visibility and implementation of the patient safety practices and care services. The initiative provides a framework through which hospitals can deliver a safer patient care. It assesses the hospitals from patient safety perspective. इस सारे इनिशिएटिव में जो कोर कंपोनेंट रखा गया है वो पेशेंट सेफ्टी को रखा गया है और उसके एक फ्रेमवर्क डिज़ाइन किया गया है जिन स्टैंडर्ड्स को अगर हॉस्पिटल अचीव कर ले तो वो दे आर कंसिडर्ड टू बी अ सेफर हॉस्पिटल. उनकी लेवल कैटेगराइजेशन की है इनटू लेवल 1, 2, 3 and 4 that will be explained later on. And overall, for this initiative encourage the national health authorities and medical and nursing school to participate in the process of providing a safe healthcare delivery to complement with national, regional and global healthcare accreditation programs. तो ओवरऑल एम यही था कि पेशेंट सेफ्टी को लेटर ऑन कॉलेजेस पे एंड अथॉरिटी के साथ भी पिकअप किया जाए ताकि कोर कंपोनेंट को मुख्तलिफ लेवल्स पे पढ़ाया जा सके. स्टैंडर्ड्स अ टोटल ऑफ 140 स्टैंडर्ड्स हैं जो इंक्लूड किए हैं 5 डोमेन्स में. 5 डोमेन्स विच आर इम्पॉर्टेंट. इसमें फिर कोर स्टैंडर्ड्स हैं, क्रिटिकल स्टैंडर्ड्स हैं एंड development standards हैं. So the basic five domains which are considered are leadership and management. Number 2, patient and public involvement. Number 3, safe evidence-based clinical practices. Number 4, safe environment. And number 5, lifelong learning. In domains में 24 subdomains हैं. Standards categorized into criticals as already explained, core and development. 20 critical standards हैं. They are minimal and compulsory standards with which the hospital has to comply to become enrolled. आपको 20 के 20 critical standards को achieve करना है for any public and or private hospital to be considered for this initiative. Core standards are essential set of standards that the hospital should comply with to become safe for the patient. It is not necessary to achieve 100% of the core standards in order for the hospital to enroll. However, the percentage of the fulfilled standards determines the level of patient safety attained by the hospital. And developmental standards हैं वो desirable standards हैं that the hospital should comply with to demonstrate an enhanced level of patient safety care. So most important ones are the critical ones that are important for enrollment, followed by the core standards. Higher the number of core standards achieved means the higher the level of patient safety of that hospital. And डेवलपमेंट स्टैंडर्ड्स जो है वो डिज़ायरेबल हैं क्योंकि वो आगे एजुकेशन से रिलेटेड है एंड दैट शोज द मोटिवेशन ऑफ द हॉस्पिटल टू कंटिन्यू enhanced level of patient care. This is the division of the patient safety domains, subdomains and standard. And यहाँ देखा जा सकता है कि लीडरशिप एंड मैनेजमेंट मेजर्स में 9 क्रिटिकल डोमेन्स हैं, पेशेंट एंड पब्लिक इन्वॉल्वमेंट में 2 क्रिटिकल डोमेन्स हैं, सेफ्टी एविडेंस एंड क्लिनिकल प्रैक्टिसेस में 7 क्रिटिकल डोमेन्स हैं, सेफ्टी इन्वायरमेंट मेजर्स में 2 क्रिटिकल डोमेन्स हैं. जो लाइफ लॉन्ग मेजर्स हैं उसके अंदर क्रिटिकल डोमेन नहीं है. तो नेट जो क्रिटिकल डोमेन्स या क्रिटिकल स्टैंडर्ड्स हैं जो एक हॉस्पिटल ने अचीव करने हैं, दे आर 20. Rest 90 are core and 30 are developmental standards. The list of standards, the 20 standards have been shared in this slide. As the slides will be shared, okay. So details of the critical standards for enrollment in patient safety friendly hospital initiatives are given in the presentation. We'll just quickly go through it. So the domain of leadership, management and measures. It broadly encompasses the patient safety as a strategic priority of this hospital. There should be designated senior staff who has the responsibility for accountability and authority for patient care. There should be a patient designated person who coordinates the patient safety checks and risk management activities. There should be regular monitoring, morbidity and mortality meetings. Hospital ensures the availability of essential equipments, and there is prompt decontamination and sterilization supplies available. These will usually be there when it comes down to leadership and management measures. When it comes down to patient and public involvement, this will check whether the consent was taken before a procedure, and all the patient had 2 identifiers. So these are the core standards, critical standards that needed to be achieved by all hospitals. When it comes down to practicing in the safe evidence-based clinical practices, so there is proper communication, clear communication channels available. Hospital systems are ensure safe communication of the pending test results to the patient and care providers after discharge. Hospital has proper decontamination of all the equipments. Hospital implements guidelines by standard like including WHO guidelines on blood transfusion and blood products. And hospital ensures the availability of life-saving medications. So these are few of the important ones. The critical we can go through the list in the presentation. All the 20 needs to be achieved for anyone who wants to enroll, any hospital who wants to enroll in the initiative. And safe environment. Hospital provides an environment where segregation of the waste products is according to the WHO standards. And hospital conforms to the guidelines of management of the waste of shops as per WHO guidelines. So in these 4 domains, we have around 20 critical standards which needs to be fulfilled for anyone who wants to enroll in the patient safety friendly hospital initiative. So once again, the important point to remember that in standards, critical are compulsory for enrollment in PSFHI. Core is the minimum set of standards as a safe place for patients, but they are not compulsory that 100% are met for enrollment in the patient safety friendly hospital initiative. Percentage of the core components achieved will determine the level of hospital patient safety that is attained by the hospital. And developmental requirements is for the enhancement in the patient care and safety that shows the commitment of the organization. 5 domains: leadership and management, patient and public involvement, self safe evidence-based practices, safe environment, and lifelong learning. As as shown in the slide, you can see the level critical is must for everyone, that is 100% for all the levels, but level increases as attainment of the core components is increased, and if more than 90% of the core components along with greater than 80% of the developmental components are achieved, that hospital is considered to be level 4 for patient safety. What does the patient safety friendly hospital initiative involve? It's a friendly initiative that aims to address the burden of unsafe practice and care. It helps the country in the region to launch comprehensive patient-friendly programs with assistance from the World Health Organization. So, what's in it for the hospitals to get enrolled in patient safety friendly hospital initiative? So, by enrolling, they are actually showing their commitment and accountability regarding patient safety, and that improves the patient's trust in that hospital. Hospital benchmark themselves, their performance against set standards, and that encourages improvement in patient safety. And using the assessment motivates the staff to improve the patient safety further. What is the role of WHO in it? WHO encourages member states to endorse patient safety friendly hospital initiative, and it provides guidelines on the process. It supports the hospital in development comprehensive patient safety systems, as well as works on building the capacity of the local team to implement the program. It also helps in establishing partnership and networks to promote the use of this initiative evaluation processes. This initiative can support the introduction of new patient safety programs in the hospitals, or evaluate or strengthen the existing programs, because it provides set standards against which the performance can be assessed. In conclusion, I'd like to say that patient safety friendly hospital initiative provides a compelling evidence that assessment of the patient safety standards in the hospital is feasible and applicable even in resource limited settings. Implementation of the patient safety standards has increased in the level of awareness of the participating hospitals as well as the patients. Indeed, the element of public engagement gives the initiative thrust in relation to other quality related programs. The ultimate aim of this initiative is to improve patient safety in the countries of Eastern Mediterranean region. While refinement of the assessment tools and their use in the countries will continue, the initiative has progressed from assessment to improvement. National expansion is being encouraged, but it is still in progress in several countries. Future research will determine whether the initiative has improved patient safety in hospital of Eastern Mediterranean region or not. Thank you so much.